Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for albuminuria or proteinuria. Mind this name proteinuria is sometimes go along with albuminuria, but truly proteinuria and albuminuria are separate things. It is said that albumin is one of the protein, but not the only protein. Still, proteinuria is used loosely in exchange of albuminuria. Now, what is albumin? Albumin is the commonest protein residing in our blood, to be precise in blood plasma, others being globulin and fibrinogen. Its normal amount in blood is 3.4 to 5.8 gram per deciliter, and it is 55% of total plasma protein. It is synthesized in liver and quickly delivered to bloodstream. Now, what are the functions of albumin? It helps maintain proper blood pressure in veins. It carries many essential substances, is called ligand delivery technically, for cells and chemicals necessary for proper functioning of the body. It also helps in exogenous drug delivery to the cells. In many cases, it helps ensure blood stays in blood vessels, that is, fluid from blood does not leak out of arterioles or venules. It helps build muscles, repair tissue, and fight infection. What is albuminuria? The term albuminuria has come from excess albumin in urine. Normally, urine may contain less than 30 mg albumin per deciliter. It is called trace amount. It is allowed. But anything more than this is termed as albuminuria, denoting trouble in kidney. This is urine with albumin. The color of urine with albumin, please note. What are common causes of albuminuria? Diabetes, high blood pressure, immune disorder, glomerulonephritis, cardiovascular disease, multiple myeloma. The last one is a type of cancer. What actually happens in kidney in albuminuria or proteinuria? Look here, this is one particular cell of kidney. This line denotes the filter bed. The filter bed. If the filter bed is okay, then the blood and important constituent of the blood remain inside the filter. No, it cannot go outside. But when the filter is damaged, note this black are albumins, these black dots are albumin. This is passing out through filter to urine. That is, kidney is leaking albumin. This is in short albuminuria. Now, how albuminuria is diagnosed? Urine dipstick test. This is urine dipstick test. This is a simple test by which we can understand that yes, whether there is albumin urine or not. Other important tests are urine albumin measurement and creatinine measurement. Mind it, when albumin is more than normal, that is actually damage. When creatinine is more, that is also an indication of kidney damage. Does albuminuria always mean kidney disease? Not necessarily. Though kidney disease is the chief cause, there are other reasons too. Sometimes not taking enough drinking water causes albuminuria. Actually, from the result of 3 tests, mind it, 3 tests done consecutively in 3 months, together with glomerular filtration rate, that is an important test also, give an idea whether kidney is in trouble. Imaging test and kidney biopsy is often done to know the status of kidney. Kidney means actually these are kidney functioning, that is the nephron, whether the cells, the cells of the nephron, the cells of the kidney, whether that is okay or not, that can be done that can be known from this biopsy test or imaging test. Now, what is GFR or glomerular filtration rate? We know kidneys' main function is to filter blood to throw away waste products, toxins, and extra water from blood. To be more specific, millions of microscopic nephrons do this filtration. GFR gives a clear idea how competently nephrons are doing their functions. GFR above 60 is normal. Now look at this picture. This is 60, this is 15, the range. GFR above 60 is normal. If it is over 60, this is normal. Kidney is okay. If it is in between 16 and 15, here it is 15, it is 16. Within this range, the kidney is diseased. Kidneys and below 15 means kidney failure. This portion, kidney failure. Kidney failure is one of the common causes of death. Now, this is a diagram of nephron. This is glomerulus, rather Malpighian corpuscles. The portion glomerulus, and the other portion of nephron is the renal tubule. This is renal tubule. Now, blood. This is written Bowman capsule, the outer capsule, which is actually working as filter bed. Afferent arteriole. This is the arteriole which carries blood to nephron, and this is the efferent arteriole. That is, after filter the blood is coming out. Note this is thicker, this is thinner. That means there is extra accumulation of blood here in the glomerulus. Glomerulus is nothing but network of fine arterioles. Now, when extra pressure is there, so filtration is done here. Extra pressure is there. From here, this filtrate means these three things: waste product, toxins, and extra water is coming out of glomerulus, that is filter bed, in the renal tubule, and it is going towards kidney. Is albuminuria preventable, or rather diet for albumin? What is the diet for albuminuria? On this issue, no distinct opinion, proposition, statements are available. However, according to a systematic review and metadata analysis published in the Clinical Journal of the American Society of Nephrology, healthy eating pattern, mind this, healthy eating pattern were associated with 30% and 23% decreased incidence of chronic kidney disease and albuminuria. That is, good eating pattern helps. Such an eating pattern comprises whole grain, fresh veggies, fruits, nuts, legumes, fish, low fat dairy products, and low in red or processed meat, sodium, potassium, and phosphorus, and sugary beverage. I personally like to make a little change in this list. Let red and processed meat be deleted from the list together. You just abandon these two. These are some images of this particular diet. Foods and drinks to be avoided from a renal diet. Renal diet means diet for the patient who is suffering from albuminuria, damaged kidneys. No rigid universal diet chart is there. Diet is actually dependent on the status of kidneys or stage of kidney damage on a particular patient, Points of concern are levels of sodium, potassium, and phosphorus in blood. In some cases, kidneys may also fail to filter out waste products of protein metabolism. So generally, a renal diet is mainly a low protein diet. Expression may be there. However, in this connection, the following points worth noting. Number one, if potassium is an issue, avocado should be restricted since it is a very high source of potassium. Please mind, some of the points may wonder you because you know that this is good, but this is not good for a kidney patient. Please note that thing. Dark color sodas, as they contain phosphorus in additive form, which is highly absorbable in small guts, and you know phosphorus is dangerous for kidney, so you have to restrict it also. Avoid canned foods, soups, veggies, beans, as these contain high amount of sodium. Though the whole wheat bread is considered better, we always try to take whole wheat bread. This is very good for health compared to refined flour bread. Yet, since the former contains high amount of phosphorus and potassium in comparison to the latter, the whole wheat bread should better be avoided. Note that just reverse concept. On the right side, some relevant pictures has been given. Please note it. It is continuing. For exactly similar reason as above, brown rice. We prefer brown rice compared to other fair white rice. But here, brown rice is worse than white rice for a patient with damaged kidney. That is, you have to take white rice if you are this type of patient. Dairy products are rich in sources of protein, potassium, phosphorus. As such, this should be limited in kidney-friendly diet. Bananas are rich source of potassium, pineapple are not. So pineapples are better choice as a renal diet compared to bananas. Oranges are also high in potassium content. In a perfect renal diet, this should be better be replaced by grapes or cranberry or apples. Processed olive pickles are high in sodium content and therefore must be restricted in renal diet. Spinach and beet green are leafy veggies actually, that is vegetables with high potassium content. These must be restricted. Processed meats like hot dog, bacon, sausage, turkey, etc., because of their salt contents are high in sodium as well as in protein, a renal diet must avoid these as far as practicable. I have already told that this should be abandoned completely. Potatoes, sweet potatoes and tomatoes are all rich in potassium content and should better be restricted from a renal diet. Also here, please note on the right hand side the images, relevant images. Please note this. Now the remedies. Arsenic album oil for albuminuria. Primary cases of tubal nephritis. Edema starts with puffiness of eyes, swelling of feet, and ends with general anasarca. Anasarca means overall edema. Grade dyspnea from cardiac troubles, hydrothorax, hydropericardium, suffocative spells at night, lying down, skin cold, clammy, while patient feel burning internally. Urine highly albuminous with waxy and fatty casts, extraordinary restlessness after midnight with burning thirst, pulse intermittent, quick, weak, slow, tense, progressive emaciation and debility of the patient. Aura met for albuminuria, renal troubles secondary to cardiac affection causing a decided albuminous crisis, passing over into hydremia. First, urine is increased in quantity, then it becomes scanty and albuminous. Bloated, shining face, vertigo as if you would fall on the left side, bruised pain in head and confused state. Calcarea curve for albuminuria. Albuminuria following eruptive diseases like variola. Pressure in kidneys and loin are loin area or aching when riding. Variola means smallpox. When riding, anxiety about heart palpitations from slightest exercise, fluttering of heart and faintness, fatty degeneration of heart. Every slight movement in bed put them out of breath. Dyspnea going upstairs after walking, difficult breathing, awaking with anxiety, with enlargement or induration of liver and spleen. Now the remedies. Cantharis for albuminuria. Cantharis for albuminuria. Early stage of albuminuria occurring from injury, blows on loins or sudden change in temperature. That is, This injury to kidney region and also temperature change. For these two reasons, cantharis is selected. Scanty, high colored urine with scalding irritation in bladder and urethra, aching pain across loins or in testicles. Urine contains an excess quantity of swollen epithelial cells which coagulates on heat and nitric acid. Post-scarlatinal nephritis. Post-scarlatinal means post eruptive fever, any eruptive fever, smallpox, measles, etc. Threatening uremia, more renal desquamation than blood. Uranium nitrate for albuminuria. Albuminuria from cardiac complications or diabetes or pregnancy. Patients are to wake up often during night to pee, which disturbs their sleep. They are irritable, cross, have pain over left eye. Sickle core for albuminuria. Post-eruptive fever albuminuria. Urine pale or bloody. Deposits look like cheese. Discharge of thick black blood from urethra. Eyesight obscured. Phosphorus for albuminuria. Right side of heart affected, producing venous stasis leading to venous congestion of kidneys, granular and fatty degeneration of kidney, destruction of epithelium, and finally atrophied. Urine highly albuminous, retinitis albuminurica. Dimness of sight, amaurosis. Amaurosis means actually partial loss of vision. Fatty degeneration and atrophy of liver and pancreas, tuberculosis, caries of bone. Calicarp for albuminuria. Tensive pain on left loin. Sacculated swelling under eyelids, that is bag-like swelling on eyelids, below eyelids. Edema of left feet extending gradually to right one and upward over trunk. Jerking of limbs if foot is touched. Urine hot, frequent, scanty, blackish, foamy. When shaken with red and slimy sediment. It is when shaken with urine, this is foaming actually. Calamure for albuminuria. Nephritis cruposa with dirty yellow sediment. Pulse slow, heart congested. Alternate state of sadness and cheerfulness with congestion of better from nosebleed. Cardiac asthma. Sensation of heart and lungs constricted with cold feet. Portal congestion and enlarged liver. So many different type of disease along with albuminuria or nephritis actually. Glonoin for albuminuria. Albuminous urine passed much at night with dyspnea and sleeplessness. High colored urine passed with burning sensations. On standing produces muddy red sediment with reddish yellow slime. Heart's impulse increased. Pulse quick, small, dry. Parched feeling in mouth. Craves cold water. Throbbing, headache, worse by jarring or stepping. Nausea with faintness. With this, the video ends. Thanks for listening and viewing. If you got any problem, please write down in the comment section. I will certainly respond.